Hi, I'm Laura Pimentel, and I wanted to introduce Dr. Mike Winters to the Maryland ACEP members. He's probably very familiar to many of you. Dr. Winters is an associate professor at the University of Maryland, and he chairs the educational committee for Maryland ACEP. In April, Maryland ACEP is all about our annual educational meeting, and Dr. Winters has put together a fabulous lineup of speakers and topics. And so I wanted to ask you, Mike, to tell the members a bit about the upcoming conference.
Well, thanks for the opportunity. To get us started with the conference, we're bringing in David Newman. Many of you probably know David Newman. David is the Director of Clinical Research in the Department of Emergency Medicine at the Mount Sinai School of Medicine in New York. He's a featured speaker on EM-RAP. Many of you probably know Emergency Medicine Reviews and Perspectives. He also holds a monthly podcast, Smart EM, which is just outstanding, reviewing the evidence, as well as you mentioned, nnt.com. And what he's going to be talking on to start us off with the educational conference is basically pseudo-axioms or myths in emergency medicine. After that, it continues to just be astounding in terms of the CME. We've got Jim Adams, so many of you know Dr. Adams. He's a professor, and he's also chair of emergency medicine at the Feinberg School of Medicine, so Northwestern University in Chicago. Dr. Adams is known nationally, internationally for his lectures on professionalism and conflict resolution. Well, following that is Josh Broder. Josh is a graduate of the University of Maryland. Josh has really made a name for himself in emergency radiology. Josh is an associate professor in the Division of Emergency Medicine at Duke University. He's also the program director. And Josh has recently published a book, Diagnostic Imaging for the Emergency Physician. It's going to be one of the leading textbooks on how you and I
Now, will Josh be playing the guitar and singing?
He may. He may. For those of you
that what I remember about Josh as a resident.
Absolutely. His musical skills are unprecedented, unparalleled. He's going to talk about abdominal catastrophes. So,
all right.
all of those catastrophes, and Josh has really got an innovative way. Hopefully we'll get this set up, but he wants to have an audience response system, so it allows us in the audience to participate, and he wants us to make this a choose-your-own-adventure.
Wow.
As we go through the lecture. So,
that sounds like it'll be something a little new and different
absolutely,
for Maryland ACEP.
Very, very exciting.
Good.
Following Josh, we're going to have Dr. Hoffman. So many of you know Bob Hoffman.
Yeah. And I always learn so much and am so entertained by Dr. Hoffman's lectures.
I mean, when you think of emergency medicine and toxicology, he's one of the names that always pops up to the top.
Yep.
He is the director of the New York Poison Center, nationally, internationally known. He's going to be actually giving us 2 talks, one on cutting-edge drugs of abuse. And we actually had a patient who had a spice intoxication recently in the emergency department. So all of these new designer drugs that many of us aren't familiar with, Dr. Hoffman's going to really give us key insight into what we need to think about, how do we diagnose it, and then how do we treat these patients.
Excellent.
And then following that cutting-edge drug of abuse, he's going to talk about managing the agitated delirium patient. We don't have any of those, so we're actually
we never
okay
see that
in
downtown
boat.
Baltimore.
But in the event that you would happen to have an agitated patient, a delirious patient, really what do you need to pay attention to? What do you need to be careful about in managing and treating those patients, treating them with delirium? So. And
do you know what's in your Pyxis?
I don't.
Yeah.
So after lunch, after Dr. Hoffman gives that second talk, we're going to roll in with just a fabulous lineup for the afternoon. Dr. Mimi Liu. So Mimi is one of our faculty. She's an assistant professor of emergency medicine. Mimi is finished residency here, went over to UCSD, so in San Diego. She worked with a number of folks and did a PEDS-EM fellowship. Mimi's going to bring us up to date on some pearls, some pitfalls in resuscitating the neonate. And following that, we've got another former graduate, Dr. Jack Perkins at the University of Maryland. Jack has established himself very quickly in the leadership role at Franklin Square Hospital, so just north of the city. And Jack is going to be talking to us about resource utilization. The title of his topic is going to be patients with low-risk chest pain in terms of getting them to telemetry. Where's the evidence? And the reason that I wanted Jack to come to the conference is because he's recently authored a position statement through the American Academy of Emergency Physicians on who really needs telemetry. Jack is out there. He's spoken nationally on this topic. He's written the policy statement. I can't forget Dr. Linda Regan. She finishes out the day. Linda is the program director at Johns Hopkins University. She's going to be talking about her niche, and that's radiology exposure, or radiation exposure
Okay.
in the ED. So all of us are very aware of the increase in utilization of CT scans for the head, CT of the abdomen, and Linda's going to help us sort through what really is the radiation exposure and what do we need to pay attention to, what do we need to counsel our patients on in terms of this frequent CT use. So thanks again, Laura.
All right.
It's been outstanding. I can't wait for the day. Very excited. I hope everyone who's listening, everyone who's watching is going to be coming to the conference, because just a wonderful day of CME and great education.